We will discuss some different issues today. So we'll start with something that is very much concern of a lot of females out there. We start with the breasts. I'm going to show you a case where breast tumor complication can take us to. If we can please show the first image we have today for that woman with the breasts, will be great. So we'll start with that. You know, the breast, beside being functional as, you know, the breastfeeding and something crucial for babies to survive, it is also something of, let's say, important looks for a woman. So a breast disfiguration is, you know, is not very good for a woman. A very small breast also is not very good. A very big breast is not also very good. So something that is in between will be very much appreciative and better. So the breast is very important for us because we all heard about something called breast cancer. Breast cancer starts with a lump, a small lump. I should be concerned about breast cancer from 40 years and above. I should have regular checkups. That includes ultrasound, mammogram, and you also at home should look for lumps or anything that was not there before and now you notice. I would like, please, if I can start with that case, with that picture, so we can talk a lot. I want you to see the end stage of somebody with breast cancer, what can it lead to, and how difficult her life might become at such young age. Let's share this together. Yes, let's pay attention here. Let's pay attention. Yeah, that is the image I like. That is the image I like. We're going to stand there for a couple of minutes. This is the breast. And I want you to look at the arm. You see how big is the arm? The arm is huge. Yes, the arm is huge. And if you look at the breast, you know, I didn't show the other one, but this one is much larger and solid and hard compared to the other one. And most importantly, when we look at the nipples are going to the inside, is being inverted, is going retrograde, is going backward. And instead of the nipples projecting to the outside, the nipples in this case, in this breast here, is projecting to the inside, is being inverted inside. So that is what we call nipple retraction. The nipple is no longer projecting to the outside, and instead it is going to the inside. If you touch the breast is very hard. And if you compare the breast from one breast to the next, if you put both hands one on one and one on the another, you notice that that breast is a little bit hot, is higher in temperature. The breast is warm. So you might be thinking infection, you know, but it is not. Now look at this woman arm. The woman arm is very much swelling all the way from the axilla, from the shoulder to the last finger. Everything is swelling. The woman is in very bad, severe pain. The pain is now extended to the neck, to the vertebra of the neck. That's about 40 years old woman, 3 kids, and now this is how she is. You know, I'm going to tell you her story briefly. Some medical clinic or health center or whatever she went to, they kept her there with this condition for about 5 to 6 weeks. This is according to her husband's story now. This is what the husband has said. They've been there for 5 to 6 weeks and they have not done a biopsy. We're talking about, in a case like this, is either could be a bad infection that is causing that, and that would be less likely because we're talking about the arm is swelling like this, that is total and complete blockage of the lymph nodes. You will ask me now, what is a lymph node? A lymph node is just like your veins, blood. Instead of blood, there is lymph fluids that circulate exactly with the same, like the same system of the venous and arterial blood. We have also the lymphatic system that runs parallel to veins and artery. So if you have a vein, an artery, you also have lymphatic vessels, and those lymphatic vessels have what we call lymph nodes, a collection of the, or a meeting of these vessels in the lymph nodes. A lymph node is very essential for us because this is where we can fight microbes the best, okay? This is where we can fight microbes the best. So now when we have a breast cancer, those malignancy cells infiltrate into the lymph nodes. Now, if I have a breast cancer this way, so my chances of spread will be either across the chest to the other breast, and in this case, I have not noticed in my clinical examination, I have not noticed any lumps or nodules or anything wrong with that other breast. Or the spread of the malignant cells could be to this way. So we can either go this way to the next breast, or we can go this way to the lymph nodes, the axillary lymph nodes under the armpit. Now in this case, what the woman has said, Doc, I noticed couple of years ago something like a small pimple. I scratch it and my arm will become like that. This is what she thinks, because she has to give herself a story to be able to live with the pain. That is also only started from a small scratch in her armpit. But this is not the case. This is just for the patient to reach psychological stability and live with the condition and convince herself that this is not really a cancer. She knows any woman out there who experienced a lump in the breast, the first thing that comes to her mind is what? Is a scratch in a pimple or a skin condition that caused the breast to be like this or the arm to be like this? Absolutely not. The first thing that comes to my mind when I feel a lump in my breast, if I'm a woman, is that monster, breast cancer. That is the first thing that comes to any woman's mind when we feel a lump, even if it's painful. Oh, I'm gonna run to the doctor because I might have some breast cancer. Now let's experience now what this woman has done wrong, okay? In order for her to reach that stage. I am sure she said it started 2 years ago. What make you wait 2 years to become in this condition and not able to do anything? And when you realize there is now something that we have to do, you go to a clinic and you stay there admitted for 5 to 6 weeks. For what exactly? What can somebody do in 5 to 6 weeks? That they cannot be done in 5 and 6 to 6 hours, right? I mean, this is obviously beyond any reasonable doubt. The first thing that comes to any physician, even though is not an oncologist, is not a specialist, somebody who just graduated medical school, when I see something like this, I know the first possibility is what? Breast cancer. Let's say it's 99% breast cancer. And let's assume 99% breast cancer when I see a situation like that, especially with the nipples retracted to the inside, going to the inside instead of coming out to the outside. So if you have the first suspicion that this is 99% breast cancer that has infiltrated already to the lymph nodes under the axilla, causing the lymph nodes to swell, obstruct, no more fluids going inside. The arm is swelling and very painful. The arm is swelling and very painful to the point that you see water coming out of the skin. Has nowhere else to go. We're gonna talk about this water. This water could be in the interstitium, meaning the space between cells. And that is easy. We have what is called cupping that we put in the skin and we suck this water out. Most of it will come out. But if the infiltration is within the fat cells, meaning the excess of water is within the fat cells, that is a problem. because we cannot suck it out. It is not in the interstitium, it's inside the cells. And that is what the situation is. We have malignant infiltration inside the cells. Inside the cells. We cannot suck it out. Okay? Let's see about the 5-6 weeks she was admitted someplace. Could something else be better? What is the confusion was where? I want to understand. Where was the confusion to keep somebody in this condition 5 to 6 weeks? For what? You know it's a breast cancer. Why would you keep her? Oh, we're waiting for the biopsy. Biopsy, that is good. Did you have a biopsy results when the husband came to me? He didn't have no biopsy results. They told him we're waiting for the biopsy. There is no biopsy that takes 6-7 weeks. Biopsy meaning I'm gonna go inside with a needle. That's called needle biopsy. We're gonna go with a needle, aspirate from the core of the tumor, send to the lab, and the histology will tell us for sure this is breast cancer. No, it is benign. It is not breast cancer. That's what the biopsy will tell us. But in this case, with a mass that big, full obstruction to the lymph node, we cannot do needle biopsy. Will be waste of time. What is the end management for a breast like that? Solid as a stone, painful. What is the end management? How are you going to manage a case like that? We take out the breast. We take out the breast, mastectomy. We take out the whole breast. We send the whole breast to the lab, and the lab will tell us that this is cancer. Then we go to the lymph nodes, we take out all the lymph nodes, send it to the lab will tell me it's cancer. So, what I did here, I don't have any biopsy to tell me. I know 99% it is breast cancer. There is 1% remain that it might not be breast cancer, could be infectious, but less likely, not with an arm like this and full blockage of the lymph nodes. So, we have what is called tumor marker. We take a sample of the blood, breast tumor marker. If we have tumor or breast cancer, there is a marker in the blood that we test for, and it will tell me tumor marker is positive. Well, actually will give me a number. Below 30, for example, the breast is normal. There is no cancer. But above 30, that will be a cancer. Her results was 240. So I have no doubt in my mind that this is breast cancer, and we just wasted a lot of time. So now what is the next step to do in this patient? I am not a surgeon. So the next step is choose a good surgeon. We have very good surgeons in Buea. I don't want to say names, but we have very good surgeons in Buea. That's an easy go. That's an easy go. So remove the breast, remove the lymph nodes, do a chemo radio, and then survival rate is 5 years. Our breast cancer today, if it's caught not late, they pass the 5-year survival. 5-year survival means you will live for 5 years or more. So if you pass the 5 years, most likely you're going to continue. So the 5-year survival rate is high. A lot of people pass the 5-year survival rate. But when a case like this becomes too late, why are you sitting? What are you waiting for? If you notice something is wrong 2 years ago, what make you wait 2 years to see the arm clogged up and blocked up like this? And not only the arm, we have cervical pain. We have pain at the level of the neck, my friend. We have cervical pain, very bad cervical pain. So what is that? That is one possibility, and that is the biggest possibility. This malignant cells, this cancer cells have traveled through the blood, through the lymphatics, which is the lymph nodes, to the vertebra, cervical vertebra, the bones right here in the back of your neck. It has traveled to that and caused metastasis, meaning migration of the cancer cells to that place. And now we have bone cancer. We have bone cancer. So that is bad. That is bad. And what makes it worse is you waiting. So what is the advice? We've seen the case now, right? You've seen what breast cancer can become. I want you to see it so you can believe that this is actually real. This patient I seen last week as a real patient, a real person, real mommy with 3 beautiful kids, with a husband, with a family, with sisters. This is what happened to her when she ignored a small lump in the breast. and she took it easy. And she tried to convince herself, oh, it was a pimple that I have scratched off and it became like that. You know, was a lump there in the breast. You know this lump has to be investigated very thorough. And you know this lump could be cancer. Now, let me not make all those young girls panic out there. Because not all cases, most of the cases of lump in the breast is not really cancer. How do you know? A cancer, and this is not 100% guaranteed, even by the best clinician that only specializes in breasts. You cannot really, there is also some cases that will skip. So if I touch the lump and the lump does not move, meaning is fixed to the chest wall, to the bones of the chest, the muscles of the chest, it does not move, it's fixed. You feel a lump, you try to move it left and right, up and down, it does not move, it stayed there, it's fixed there. That is dangerous. And it doesn't pain. That's dangerous. So when it doesn't pain, that is bad, because that is most likely cancer. And to be confirmed with, you take a lumpectomy, you take it out, you send it to the lab, make sure it's not cancer. End of story. You catch it when it's there, small. Then you have a nice survival rate. 5-year survival rate will be fine. You will survive, you will live. A lot of people with breast cancer, treated breast cancer, are living. So lumpectomy, we remove this nodule. But the good news here, if you have this lump and you get your menses, it decrease in size. The size fluctuate with the menses, then you don't have to worry about it. That is something very small. We can easily treat with medication and you don't have to worry about it. But the rule is surgical rule, any lump in the breast has to be taken out and sent to biopsy to be safe. So you don't come to me later, Doc, I came to you a couple of years ago and you told me it was nothing and now I have a breast cancer. We have a rule. No? The doctors have a rule. Any lump in the breast, you must take out and do biopsy. Biopsy mean what? I have to look under the microscope and see if this is normal tissue or cancerous tissue. That's what it means. And then we follow up according to the results of the biopsy. What is biopsy? Is the most definitive, most accurate. No say after biopsy that this is what you got, assuming that the histology lab is accurate and is good and is reliable. When you tell me I took this patient blood and I sent it to France and I'm waiting for 3 weeks to get the results, something is wrong with you. Because in Cameroon, we have tumor markers, my friend. Any decent clinic and lab, we have tumor markers that can test specifically for breast cancer. We call it breast cancer tumor marker. Is there available? So what we needed to send it to France for? We have good clinics, we have good labs, we can do what France can do. Why would you have to send it to France? Or this is just a story you're making up? Because I don't see a reason. It makes me a bit uncomfortable when I see, not good reasons to save somebody's life. You send a tumor marker to France for what? Tumor markers are valuable here. 30,000 is done. Why you have to send it to France for and wait 3 weeks meanwhile the patient is suffering? And we could have said every day that passes by, more spread for the cancer. That's why. That's why, it makes me angry. It makes anybody with a little bit of consciousness angry when you know your patient is most likely breast cancer and you're waiting. Waiting for what? Waiting for what? To reach end stage is not fair. And let me remind you of something. What goes around comes right back around. If you're unfair to somebody, somebody will be unfair to you. This is God's rule. This is not my rule. This is God's rule. Whatever you do bad to people will be done to you.